As the Commissioner of Insurance for the state of Mississippi, it's Mike Cheney's job to know health insurance inside and out. But he says health care can be intimidating for the consumer.
So we tell them, if you need help, just call us on the phone. It's okay.
He says next year's health insurance outlook shouldn't be daunting for folks, with rates lowering 4.5%.
We've had some decreases in individual and group rates throughout the state, from the major carriers being Blue Cross Blue Shield and United Healthcare in the state.
And Ambetter Health Insurance Company will carry the Affordable Care Act next year.
Their rates will actually go down a little bit this year.
With Mississippi having a high employment rate, he says that means uninsured rates are down, but that's not the case for everyone.
We have about 300,000 plus or minus 20,000 either way at any given time that are uninsured in the state.
So Cheney worries. You see, the uninsured create a domino effect that tumbles to rural hospitals, health insurance companies, and in worst case scenarios, your access to quality health care.
We've had 4 bankruptcies within the last 2 months by rural hospitals.
Cheney says if someone with no insurance or Medicaid walks into a hospital, they have to be treated. He says that's a federal and state rule, leaving hospitals to take the financial hit.
As an example, the Greenwood LaFleur Hospital, which you would think would be very prosperous, lost $1.7 million in the month of July. And that's in addition to 11 previous months with losses of over $1 million each month for 11 months.
Here's how it impacts Mississippi consumers. When the loss is too great, hospitals close. It's happened to 5 rural hospitals in our state since 2010. And Cheney says if health insurance companies don't have access to providers, then customers don't have local coverage. So if the worst happens to Greenwood Hospital, residents there would have to travel 40 minutes to an hour to find care elsewhere, like in Greenville. And this isn't Cheney's only concern that impacts your health care.
The cost of drugs or prescription drugs in the state, they tend to go up.
Cheney says the price of prescription drugs has tripled and quadrupled in Mississippi, costs that are solely controlled by the Pharmacy Association and benefit managers.
And prescription drugs constitute 30 to 32% of the rates that consumers have to pay on a monthly basis for health insurance.
To even begin to know what insurance plan is best for you, Cheney says you have to know the cost of your meds. Come January 1st, 2019, Cheney says he's going to help you do that by posting companies' drug formulas on his department's website.
They can go to our website and say, hey, these drugs are not covered under my policy. I want to know why. Or they are covered and I'm paying too much for them.
Without guidance like that, consumers can run into pitfalls trying to find a health plan. And that's where the state and nonprofits like Health Help Mississippi step in.
We see consumers who are having to make a choice. Is it either buy my groceries or buy my prescription drugs?
Senior Program Manager with Health Help Mississippi, Carrie Abernathy, says they help the insured, uninsured, and underinsured find healthcare options they can manage.
We have a free screening process where we will ask some questions of the consumer, their family makeup, what does it look like, and hopefully guide them into a reasonable option.
Abernathy says Health Help can provide a consumer guide to knowing your rates, know what you're being charged, and finding hidden costs.
Going into that, really understanding what your plan means for you, and it really helps a consumer on the back end really lower any out-of-pocket expense that they have.
She says they're here to make sure that expense doesn't turn into a liability. She says 52% of consumer debt in the U.S. is medical debt.
Mississippi has the highest rate of medical debt in the United States.
And Cheney and Abernathy agree seeking or having health insurance shouldn't feel like a burden when there are resources like them out there to help you.